Perfect. Thank you. And so I think a lot of the staffers, when we do make phone calls and when we do have these connections with them, just a small reminder to treat them with kindness. Treat them how you want to be treated because they are just human beings like you and I. A lot of them receive not the best pay, unfortunately. Staffers don't make a ton on Capitol Hill. They don't make a ton in the district offices. And more than likely, if you build a relationship with that staffer when you call, or even if it's just a scheduler, they're going to remember that kindness. And I've had instances where I was able to build a relationship with an aide in Representative Mervan's office, who is the rep for District 1, which covers like East Chicago, Gary area. And they loved our message. They loved our affect so much. They moved what we had brought to the representative's desk. And so just wanted to share that because I think there is a misconception that these people are all evil and they want, total destruction for all folks that are low income and moderate income. But a lot of them are confused as well by what's happening. And so I think, again, when you do make these phone calls, be polite. We have that Hoosier hospitality here. Use it. And I think it's one of the best things about us. We are typically a kind people, and we want to make sure that we share that with our representation as well. So, anybody have questions or comments, or if you wanted to share too how you feel you'll be affected by Medicaid and Medicare cuts, please come off on mute, or you can put it in the chat. Alrighty, well, that's okay if nobody wants to share or has comments or questions. That means we've been doing a good job so far answering them. But please keep the questions coming. But Tracy, I'll pass it back over to you for additional comments.
Oh yeah. Well, I was just gonna add, I was thinking a lot. I think you made a great point about sharing stories and making certain that what you're talking about is like grounded in your own experience and not like those people over there, right? Or like those poor folks, right? That's what you're trying to avoid. The thing that I really encourage folks to reflect on as we kind of go into this empower section, this like taking action section, is that you are more likely to motivate the people around you and to move the elected officials that you're speaking with if what you're saying is really grounded in your own self-interest and your own experience. And so, sometimes I meet folks who are, middle class, upper middle class, and they're like, I don't know anyone on Medicaid. I don't have any problems, right? And, like they'll say stuff like that. Because for whatever reason, right? Sometimes some of us internalize a bunch of like, I'm okay, there's nothing wrong. But I always ask people like, no, take the time to think about like, is there a time in your life where you couldn't get care, right? Is there a time where you actually didn't fill a prescription because you couldn't afford it? And really think about how the health system that we have has impacted you. Because even if you think you don't know someone on Medicaid, or you're certain that that is the case, Medicaid is a part of a larger like health system that I can guarantee, unless you are a member of Congress or extremely wealthy, like you've been screwed over at some point or another with the way that our health system operates. And so, starting from that place as like, hey, even if you're like, I'm a privileged person, I'm an upper middle class person, or I'm a wealthy person, like there are going to be ripple effects because when we're all sicker, we're all more likely to get sick, right? Our public health is really this way in which our humanity is demonstrated to be so profoundly interconnected. So, I really encourage all of y'all, like, take this time that we have together on Sunday and get really clear on like what is in this for you. Because, none of us are really, getting a good deal in this current health system.
Absolutely. Thank you for that, Tracy. And I see Chad has his hand up, so go ahead, Chad.
Hey everybody. So she actually just touched on something that I was going to speak about. I would implore us to kind of spearhead educating our public health. A lot of our CBOs and a lot of our nonprofits and grassroots organizations. Because as I think about just some of these populations, especially like the LGBTQ plus Q community, the trans community, gender affirming care, a lot of individuals, and this is such a baked situation just based off of, the disparities that people have. Some of them are of their own volition, some of them are not. But a lot of people are so used to having, if you have specific barriers or have specific disparities, back in the day, insurance and medical insurance was automatic. And so now, a lot of the public sector and public health organizations, they're in a frenzy right now because one, they don't know what's going on. It's affected a lot of the finances, but they have all the resources and tools to be able to help aid our community in other fashions. So when I say this is so baked, it's kind of going back to some of what I'm working on with Count Us in regards to getting people to care about it, versus, it hasn't hit my door. I'm used to having this support here, but now it's here. So how do we get people more inspired to be able to spearhead, like, speaking to our constituents and, or just educating our peers, everybody is so fixated, and you touched on this yourself. Everybody's so spread thin right now because the world is just upside down. And so getting people to care about something beyond their shelter or beyond their safety net um, is another faction that we have to consider, because this what we're talking about right now. It's talking about language. I was going to put in the chat, we need to be more educated on what it looks like federal versus state, because I personally am just now learning what that looks like, and so all these factors, I just wanted to throw that out there in regards, because I was just thinking about, me as somebody who is I don't identify as LGBTQ plus in the community, but I'm same gender loving. But I'm for all people being their 100% authentic self. And so I was impacted with disparities a long time ago, and I was able to get hip, and now I've crossed over into a realm of, working for the nonprofit world, or just becoming more aware, more woke, more educated, and crossing over into getting the insurance from my employer. And I do implore everybody to work, but everybody isn't able at a specific given time. And so I'm just throwing out some feedback on just what I'm gathering from all this. That's all.
No, absolutely. Thank you so much for sharing that. And thank you, Chad, for the work that you do within our LGBTQ plus community here in Indiana. We need more people speaking up. And yes, unfortunately, something that is under attack within the One Big Beautiful Bill is they're going to cut gender affirming care. And something that Jalen had put in the chat yesterday, excuse me, just right now, yesterday, Countess Indiana was at the Pride Prism Marketplace in Columbia City, and we met somebody that was going to get their chest surgery done. And now it's in limbo because of these cuts. Insurance companies won't pay for it. They're just being told you have to wait. And it's heartbreaking when you're unable to be your true, unequivocal self. I'm very blessed enough to not have had that experience where I get to live and be who I am every day, and not be impacted because of, social structures that are extremely harmful, to say the least. And so, Jalen put in the chat, gender affirming care does save lives. Absolutely. 100%. And I see gender affirming care in multiple ways. I see us, being able to get something changed about ourselves that we don't like, that make us feel, maybe wrong, or it And so we are able to get that fixed. But they're targeting the trans community right now for many, many reasons. And for a lot of reasons, it's a scapegoat. It used to be I watched this advocate testify in front of the Texas legislature, and he said it used to be the Black community that you were scapegoating. It used to then be gay people that you were scapegoating. Now it's trans people, non-binary people that you're scapegoating because you want to ignore actual problems that your policies have caused. And so I think it's important for us to speak up and to be an advocate. And something that I really love about advocacy is a lot of people don't think that their voice has any power or that you can't do anything with it or that they won't listen. I disagree. I really disagree because I've seen the power of advocacy. All of us gathering here together as a community, that's collective power and that's collective impact. And tomorrow on Monday, when we make our phone calls to Capitol Hill and we take our action steps, which we'll talk about here in a moment, we're going to see why it matters. And I think it matters because even if our members of Congress don't listen to us, at the end of the day, you made somebody in your community feel heard. If you're not impacted by what happens with Medicaid and Medicare, you know, I'm glad because I don't want one less person to miss having that health insurance, but that doesn't mean that your voice still doesn't matter. It doesn't mean that you don't care. And so I think for me as a queer person of color in this state, it means so much to know that everybody here on this call is advocating because they know Medicaid and Medicare are at risk and are under attack, and they care about the queer community and the trans community and also farmers. Something that Tracy had touched on earlier is rural communities are going to lose their hospitals because of the economic aspect that Medicaid brings in as a business. And so if you live in a rural area, the rural area we were in yesterday, they're going to lose access to local hospitals if these cuts go through for Medicaid and Medicare. And that's not right to us. I don't think that sits right with any of us on this call right now. And so I want to check in the chat. Absolutely, Chad put there is power in provoking thought. Absolutely. And so we're going to do a quick kind of role play of what making a phone call to your member of Congress looks like. And so we can just do that real quickly. It won't take 5 minutes, Tracy, but would you prefer to play the advocate or the staffer? What would you like to do?
I think I'd like to be a staffer today.
Good.
Yeah.
Alrighty, well, I'll kick us off. Hi, my name's Sarah. I'm calling from Fort Wayne, Indiana, and I have a message to share with Senator Young.
Oh, that's great. Could you give me your address real quick so that I can record it for the office?
Yeah, absolutely. It's 111 Strawberry Lane.
Great. And that's in Fort Wayne. Okay, awesome. Thank you. Just want to make certain that you're a constituent.
Absolutely. So I'm a registered voter. I've been voting for a long time now, but what I'm calling about is I'm calling because I'm deeply concerned about the cuts to Medicaid and the proposed budget bill. We know that it's moving on to the Senate now, and I just really urge Senator Young to deny and reject any cuts to Medicaid and Medicare as much as possible. My family relies on Medicaid to pay for their health insurance. When my grandma was going through chemotherapy, Medicaid and Medicare paid for all of that. And so it really saved her life in a lot of ways. I don't know if she would be here if it weren't for those programs. And so I urge the senator to listen to his constituents rather than folks with a lot of money in their pockets. So that's what I would encourage you to share with the senator.
Okay, well, thank you very much. I will pass that on to Senator Young and our healthcare staff.
Awesome. Thank you so much. And what was your name?
Oh, my name's Tracy.
Awesome. Thank you so much for your help today, Tracy. Appreciate it.
Thanks, Sarah. Have a good afternoon.
Thank you. You too. All right. So that is just a very basic role play that you can engage with or utilize when you make your phone calls this week. And so you may have noticed that we put a toolkit in the chat, which has pretty much every single thing that we talked about today and also additional information that we didn't get to touch on. And so if you open it up, it tells you, it actually gives you like a guide of where you can go. And if you click on any of if you go to, actually, let me just share my screen because I am a visual person as well. If you open it up and you click on, let's say you want to go to text-based advocacy, which covers like emails and then text messages, you can click on it and it'll take you directly to the toolkit where you want to go. And so very easy, very effective, and everybody should have access to it. I did want to highlight the education resources section because we tried to make this very intuitive. So if you want more information on the specific Medicaid provisions, so the cuts that they're going to be making, you can go here. If you want to know how this will impact Medicare recipients, you can click on these articles here. If you want to know how this will impact the disability community, how it will impact mothers, families, and children, harm Black and Brown communities, and then just general information on contacting your members of Congress and understanding reconciliation. There are categories for that as well. But our call to action today is pretty simple. And so we'll go by real quickly, step by step, what that looks like. So let me get back up to where I was. So, and the call to action is also within the toolkit too, if you need clarification. So step 1, from now until the first week of July or until whenever they finalize the bill, we need every Hoosier, yourselves included, to be contacting Senator Jim Banks and Senator Todd Young via email, phone calls, writing to local media, which any of these scripts within this toolkit can easily be submitted as a letter to the editor, which we have about 8 newspapers in the state of Indiana that will accept letters to the editor in the opinion section. So if you ever see like an opinion section or a letter to the editor, that's what we're referencing. You can turn that into local media and submit it and have the call to action. And so we're asking them to prevent any cuts to Medicaid and Medicare from making it into the Senate reconciliation package. So if you hear reconciliation, that big fancy word, that just means the bill that they're working on that includes Medicaid and Medicare. So step 2, think of 5 people that you can text and ask them to call their senators as well. And they don't have to necessarily live in Indiana. Do you know other people in other states like Missouri or Maine or Alaska or North Carolina? Within the toolkit, we mention Senator Hawley, Senators Collins, Murkowski, and Tillis from the states I just mentioned. And these are folks that are fighting hard to protect Medicaid and Medicare as much as possible, and they are Republicans. And so just wanted to put that fact in there. And then step 3, if you have time, call Governor Braun's office because eventually the fight will come back to Indiana and we need him to make sure that he doesn't sign anything into law that cuts Medicaid and Medicare to the best of his ability. So those are your call to actions. And so I will drop this in the chat as well. But you have this information within the toolkit. And so I also want to uplift some of the questions that Tracy had put in the chat that offer some good self-reflection if you don't have a Medicaid story, or if you yourself are not on Medicaid. So think of a time when you weren't able to get care and you needed it. What happened? How did you deal with it? Have you ever been delayed care because you couldn't afford it? What was that like? And lastly, what would happen to you and your community if there were fewer doctors or other healthcare providers? That's what we need our representation to hear, how it's impacting their constituency, because there's nothing more powerful than an upset constituency using and utilizing their voices and calling in. And so really encourage folks to think about that when we break out into our breakout rooms, just the importance of why should this matter and why does this matter? So I'll stop there. Does anybody have any questions or anything they would like to add?